Good day. Hi, I'm Brian Castle, and I'm a physician and physician executive. I've been doing this for about 50 years. The little white character on my shoulder is the bird that owns me, and his name is Poppy. Today, we're going to talk about Healthcare 2020, and specifically, we're going to talk about return on investment. So I'm going to slide out of the way and bring the slides into focus. And if you're ready, here we go. Now, this is the fourth vlog in what I'm calling part one. And we've been discussing the impact of healthcare coverage or lack of it. Now, I was just retiring for maybe it was the second or third time when a congressman, whose name and state will remain hidden, Idaho, flushed with victory after the House of Representatives passed health care reform in 2016, he went and appeared before his local town hall. Now, much to his surprise, one of his constituents confronted him with the comment, "You have just voted to take away my health care. We're all going to die." His reply, "No one wants you to lose your health care. Besides, no one ever died from lack of health care coverage." You can imagine the crowd's reaction to that statement. Me, I had to come off the sidelines, and after researching the subject, I now make it my current focus to talk about health care, not in hyperbole or promoting some unsubstantiated data, though I do have my opinions. My approach to Healthcare 2020 has been to research the facts using the logic of evidence-based medicine, and I will present those facts based on what that research showed us. Now, it's up to you to do your homework and determine which data is relevant to you as you face the difficult task ahead of deciding the future of Healthcare 2020. That said, let's look at our current model. Our current model, as we have discussed before, is the for-profit healthcare insurance model. There are the payers. Here are the players. One of them is the payer, but here are the players. The first party, the providers of healthcare. The second is the patient or the consumer of healthcare. And as I said before, the third party is the payer of health care, or whoever pays for the service. And unless it is you who pays directly for the service, these payers will not pay the listed charges that our providers bring to bear. Now, we talked previously about who pays for what. Employers pay for 49% of health care, government roughly 35%. Self-pay 7%, that leaves 9% of us uninsured, not to mention the 30+ million folks who have coverage but don't access that health care due to cost. But one important party is missing, or rather more correctly, lurks behind the scenes. These are the decision makers who are driven by the for-profit motive. So, with that in mind, why is this important? Well, our current healthcare model is broken. It is driven by profit, which impacts your cost. But it is not just cost. People die from lack of health care and access to that health care. People are injured or died because of the quality of the health care that's being delivered. And in a lot of cases, it's not adequate. People suffer not only from the quality of health care, but people suffer because of what I like to call the social determinants of health care, or the non-medical drivers of health care. And so if we look at that equation and try to find out what the return on investment is, it's a combination of four factors. There's cost, there's access to health care, there's the quality of that health care, and then there are the non-medical drivers of health care that we call the social determinants of health. And why is healthcare broken? Because there is no return on investment. What does that mean? We pay more than any modern country in the world for our healthcare, but we get very little bang for our buck. For example, we're paying about $11,200 for every man, woman, and child in this country. Yet, that's the most anybody pays. But what do we get for it? Well, we rank 35th or lower in all of the things that people measure to determine the quality of healthcare. So the bottom line is, we don't get any bang for our buck. So we're going to talk about cost, access, quality, and the social determinants of healthcare, and see how that all interplays to develop our return on investment. Let's talk about the social determinants of health. Here they are: economic stability, and you can see the things that are involved with that. Neighborhood and physical environment, housing, transportation, and these other things. Education, literacy, language, education, etc. Food, hunger, access to healthy options. And then there's the community and social context. And these things are social integration, support systems, etc. And then we have our healthcare system, healthcare coverage, access, provider availability, and the quality of care, which both of those we'll talk about in a minute. And at the end of the day, we need to see what our health outcomes are, or our return on investment. And what are those health outcomes? Mortality, death. Morbidity, how sick you are. Life expectancy, how long you live. Healthcare expenditures. Yes, I know, Poppy, you want to get involved, but let Papa do the talking right now. Healthcare expenditures, that's cost, health status, and the functional limitations that we as people have based on our healthcare. So, that is our social determinants of health and how they interact. Now let's talk about access, because ultimately it comes to access. Barriers to access, you can see them listed here, and I'd like to point out that it doesn't matter if you're uninsured, if you have Medicaid or of the public payers, or employer or other private payment for health care. A lot of us have no usual source of health care, access, or we postponed seeking care due to cost, or we went without needed care due to cost, or we postponed or didn't get our prescription drugs due to cost. And I also would like to show you that women get a higher share of difficulty of getting their health care taken care of due to cost. If you look at men and women and look at the factors that were measured, more women than men went and delayed or went without care. They put off or postponed preventive services. They skipped recommended medical tests or treatment. They didn't fill prescriptions, or they didn't take their medicines as they were prescribed. And they have problems paying their bills, or they're currently paying off bills. And again, women are more impacted by logistical problems, and specifically lower income women. Now you see all women, less than the poverty line, greater than the poverty line. And as you can see, what are some of these logistical barriers? Couldn't find time to go to the doctor, couldn't take time off of work, had problems getting child care, had transportation problems. So all of those things impact women and not necessarily men. So that's the topic of access. So we've talked about the social determinants of health, we've talked about access. Now, let's talk about cost. And again, the end of the day, access is driven by cost. And we have talked about this before, and I'm not going to spend a lot of time on this slide, but just because you want coverage doesn't mean you're going to get it. And there are many barriers to getting that coverage, and each of those barriers ends up with more money out of your pocket. And we've talked about that on a previous blog. So that's cost. So we've talked about the social determinants of health, we've talked about access, we've talked about cost. Now let's take a look at quality. Did you know that accidental death is now the third cause of death in the United States? And if we look at how many medical errors there are, this is what the data shows us. In 1999, the Institute of Medicine said about 44 to 98,000 deaths annually due to medical errors. In 2004, AHQR, the Agency for Healthcare Quality and Research, reported about 195 deaths a year in the Medicare population. In 2008, the Inspector General reported 180,000 deaths in Medicare patients related to the quality of care. And in an article published in 2013, the death rate was 1.13% due to medical errors. And this then factored in, gave you a number of about 400,000 per year, which is about 4 times what the IOM report said back in '99. As a result, if you can see the leading causes of death, and 2016 is the last data we have, in 2016, unintentional injuries jumped over pulmonary issues. And these unintentional injuries include death due to medical errors. So, let me talk about what we've talked about. Essentially, we have a for-profit healthcare system that's broken because there is little or no return on investment. We spend more than any developed nation on earth and rank in the lowest tiers when health outcomes are measured. We talked about those health outcomes: mortality, morbidity, life expectancy, healthcare expenditure, health status, functional limitations, when calculated by the factors such as social determinants of health, access, cost, and quality. We will take this a step further and finish part 1, where we eventually will get to the proof that not having health care, not having access to health care, could kill you. But for now, here's the commercial. Go to my website, www.americanhealthcareintransition.com. Subscribe so you can get information, the information that you need to make decisions about healthcare. And we will talk next time. This is Brian Castle saying good day. Thank you. Bye-bye.